meaning of safeguarding?
Safeguarding basically a means of protecting people's well-being and welfare, and protecting them from abuse of their rights, particularly those who are vulnerable.
Well done, thank you so much. Anyone would like to add on this?
Safeguarding involves protecting people from harm.
Very good. Protecting people from harm and from neglect. Well done. So why we put lots of pressure when we work. Always we need to remember safeguarding. Safeguarding is a very important concept, not only in the care, in any organization. So even if I work in IT or if I work in supermarket, they always have to give you every year safeguarding training. Why? Because it is very important concept. So everyone, especially in care, they need to do a training in safeguarding every year to renew their knowledge, their skills, their experience. So it is all about the right to live safely and free from any harm, neglect, or abuse. So it is embedded in our work. So everyone is responsible for safeguarding their clients. So whatever, how many clients do you work with, each of you, you need to protect your client and also everyone in the center that you work in. Even towards your co-workers, you need to take care of your co-workers, you need to protect everyone, especially the vulnerable people you're working with. So it is responsibility for each one of us at work who work in health and social care to protect and help the vulnerables and prevent any kind of abuse or neglect could happen to them. Most important thing we need to remember is our job is not only to protect them, but also to empower them. So how we can empower our clients? Do you know that? How can you protect and empower your clients?
That we have to assist them to be able to keep themselves from harm or do anything that can affect their well-being, guide them, and give them the basic skills that they can use to protect themselves.
Excellent, that's very good. Thank you so much. So for us as people who work in the health and care sector, we need to protect our clients. We give them the tool, we give them guidance, we help them to make the right choice for themselves. So if they are planning to do something really you think it's going to have an impact on them, maybe you should stop them, maybe you should give them ideas, maybe you need to tell them as well that it's not good for them and why. Not only to say, okay, you can't do that, but you need to give them some information. You need to tell them why this is not good for them and how this is going to affect their life or their health, or it's going to affect them in any way. And also to empower them, which means you encourage them. Your videos start breaking up. Maybe you need to say again, please. Okay, I'm really sorry. I can't really hear you, but I'm sure you'd like to add something really important. It is all about protecting them and also empowering them. So how we can empower our clients? We empower them by help them to speak up. So if they got anyone who abused them or neglected them, we need to help them to speak up, to tell the management, to tell the other employees, maybe to take a report from them and submit it to the management, or maybe give them something like a feedback sheet. We can help them in so many ways and empower them to speak up so they don't become shy and isolated and accept the abuse just because they had been abused in the past. So many people who are we working with, especially for you, you work with young adults. They all maybe they had some kind of abuse in the past, or they had some problems in the past. So when they have now any kind of abuse or neglect, they might think it's normal. It's okay to be abused. It's okay to be, but for you as a care worker, your job is to tell them no. You should say no to that. You should be empowering them to speak up, to tell the management, maybe take from them a report about what happened with them and pass it to the management, or maybe just encourage them to tell you more details if they are shy or if they can't speak up for themselves. So it is very important for you to empower them, not only protect them. So there are so many types of abuse. Can anyone tell me what the type of abuse do you normally work with?
Sexual abuse, physical abuse.
Very good. Physical abuse. Could you please tell us a little bit more about it?
The physical abuse is unwanted contact leading to injury or pain. And the sexual abuse is actually forcing someone to do some activities that they don't want to.
Absolutely. Very good. Thank you so much. Thank you. Anyone would like to add to this?
We have also racial abuse.
Very good.
Yeah.
And what is that all about?
Racial abuse is to use someone's tribe or tradition to mock him or her.
Absolutely. Well done. Thank you so much. Thank you. Anyone would like to add to this?
We have financial abuse.
Oh, well done. Very good. Yes.
Yeah.
Can you tell us a bit more about it?
Yeah, that's the art. I don't want to say that's the art of abusing one financially.
Absolutely. Yeah. It's like using someone's card or someone's
Card,
money to buy
yeah.
their own stuff. Well done.
And emotional abuse.
Yes. What is the emotional abuse?
To do things that will send trauma to a person emotionally.
Well done.
Okay.
Hello.
Anyone? Yes.
I have a question here regarding the financial abuse.
Sure.
Let's say that you take a young person to shop, and let's say Tesco, and the young person doesn't have club card or maybe Waitrose or those cards, and then you use your card to drop some of the amount for the person to pay less. Is it financial abuse?
No, that's you helping him. Thanks to you. So sometimes I go with my sister and I forget, for example, a Superdrug card, and I always ask her because it could use my expenses. It's really good. You're helping them. This is not financial abuse. Unless if you use their own card to pay for your own things, that's a financial abuse. But this is just helping them.
Helping, yeah, because I encountered it. I was working somewhere, and then it's happened to me, but the manager said it's financial abuse because once I've used it, I'm gonna get some points.
Yes,
I'll
but
get
how
points,
much?
even though it's yes, how much? So we were warned not to do that. And I was also saying that I'm also helping to reduce the amount the person is going to pay. So it was on both sides, but we were warned not to do that anymore. That's why I asked. Thank you.
Welcome, thank you. To be honest, for me, this is not financial abuse. In fact, you're helping them. You reduce their spending by a lot. It's like, while for you, you get a few points. You don't even get money for this. But if the policy in your organization says something else, just follow the policy, because it's very, very important for any employees to follow the policy, even if you think, like, I'm not 100% sure about this. Well, this is the company policy. This is what you have to work with. Just follow the policy. But maybe in another organization, they would tell you totally different things. But thank you so much.
If I may add, I think when there's a cap as to how much the person can use, then when it's going beyond the limit, you can stop the person. But if there's any cap where he can spend whatever he wants, and the money belongs to him or her, and you want to stop the person not to use the money, then I think that you are abusing his rights, and it is tantamount to financial abuse. That's what I think.
Yeah, it's good to stop them from spending too much. To be honest, if they spend too much, it's their own money, so you can't stop them, but you can always advise them, tell them that the money is very important, it's very hard to get by, so just let us spend less, so you can save for the future. You can use this money to buy something when you grow up. It's good for you. You not only encourage them and protecting them, you empowering them and give them some ideas for the future. Thank you. That's really good. So let us get one by one. Let us discuss each one of these types of abuse by itself. So first of all, we have the physical abuse. So could you tell me in more details, what is the physical abuse?
Physical abuse, a typical example can be or normally emanates from, say, couples, where maybe the man or the woman both always punches the partner when he's angry or something. It's a physical abuse. Or where a child is hungry, or that you have to provide a food, but he or she has done something, and you deny the food as a punishment on the child. That also, I think, is a physical abuse.
So let us start by explaining what's physical abuse. Physical abuse is anything physical. So start by hitting, biting, kicking, maybe you punch someone on the belly. All this is a physical abuse, anything physical. So for us as people who work in care, if you have your client, he's angry one day and you want to calm him down, you just hit him on the face, or you slap him, or this is all physical abuse. You're not allowed as a person in care to do all these things. You can't hit or bite or kick, or anything physical is not allowed. Otherwise, this is big no for any organization. It's a physical abuse. When it comes to partners or children, so if you hit your child, your own wife or partner, this is all, it's a domestic abuse. It's a very similar, it's comes
Yeah.
with physical things as well, but could be bullying, could be beating, hitting, kicking, any type of abuse can make this family member feel bad about themselves. That's a domestic abuse. How about the sexual abuse? Sexual abuse is include any unwanted sexual contact with the person. So for you, if you work in care, you have to be very careful about how you interact with the young adults, because anything could be explained as sexual abuse if you, for example, any kind of touching, or maybe for you you think it's okay because you working with them closely, but for them maybe they explain it differently. So you have to be very careful about what you do with these young adults. Also, we have the emotional abuse. That's people hardly talk about the emotional abuse because it's not something you can see or you can feel. Sometimes maybe just yelling at the person make him feel small or make him feel isolated. So it just anything make this person not himself worry. He could feel small, could maybe just like telling the person, oh, what are you doing? I really don't like this. I always you do wrong stuff. You always not good. You do things not good enough. Even these small words could consider as emotional abuse, because in their head they are okay. When you tell them they are not good enough for anything, they will, because they are vulnerable, they will think a lot about it, and that will make them very isolated. They wouldn't want to talk to anyone. They will think that they are not good enough for real, because they will believe you. You are the protector. You are the person who's helping them. So anything negative you tell them, they would believe it, and that's emotional abuse. As your colleague was talking about the financial abuse is using someone else's card. For example, I work with a client, I use their card, pay my own things, like go and do some shopping, go and do shopping online, buy things from eBay or Amazon or whatever. That's financial abuse. Or maybe they have some money, they got it from family in the cupboards or drawers, and someone take it to pay for their own things. Or maybe sometimes the client give you some money to buy them anything. You go to the shop and then you don't give them the change. That's financial abuse. Any type of advantages on the client's money, that's financial abuse. How about modern slavery? Have you ever heard about the term modern slavery? It's a huge issue in the world now. Can you
Yeah.
tell me what does it mean?
Where people go to the vulnerable places. If I may use example of Africa, where most people are vulnerable, then people go there, and then they export them to maybe the Western world, to use them as sex workers, and yeah, taking advantage of any vulnerable person and use him to do things that he's not supposed to do, I think.
Well done. Thank you very much. Anyone would like to add anything to modern slavery? So let us talk about it. As your colleague said, it's all about using the poor people, the people who are vulnerable, and from any country. It doesn't need to be from a specific country, but There are some countries are poor countries. So what people with advantage they do, they take this person to travel him to another country, to their own country, and they use him like he can be working for them for free. He can be cleaning, or she can be cleaning, doing anything for them, and they don't pay her, they don't take care of her, they don't give her nice clothing, they don't take her out, they don't teach her the language. So when person come from different country, they don't even know the language, so they become isolated in their own society or their own place. They can't even talk to people, they can't communicate, they can't even go to the police and report their situation, that they are working for free. So this is all modern slavery, which is prohibited in the world and it shouldn't be happening and should be reported as soon as you see something like this. Any other types of abuse, you know?
Religious abuse.
Say again?
Religious abuse.
Okay. And what does it mean to you?
Yeah, where you prevent your clients, or you prevent anyone from exercising his or her faith.
Absolutely, that's a good way of saying it, because if you think about it, we are all different. We all coming from different backgrounds. We all have different religions. So if you are really strong Christian and your client maybe he's Buddhist, or then you prevent him from doing his Buddhism things, and you start telling him, and he has to be in the same religion, and he has to do this and he has to do that. This is all abuse. Why? Because everyone of us has got their own religion. They respect this religion. Some of us, maybe they have no religion. It's fine. For you, you carry on doing your own things, and you don't need to enforce your religion on others. Very good. Thank you very much. Also, there is discriminatory abuse, which means, and anyone knows what does it mean?
Abuse, to discriminate means that you bring you favor somebody than the other. For instance, if you are a carer, or you are dealing with your clients, you should serve them in the same way. You can't say that, okay, this person is from maybe where I come from, or this person, I like him or her, and therefore when I'm serving him or her, I put all my heart on it. But somebody I don't like, or he doesn't come from where I come from, and therefore I don't take much heart to whatever I'm doing, then you are discriminating.
Well done. Thank you very much. Anyone else would like to add? So, as your colleague said, discriminatory abuse is mean we discriminate people. Like, I don't treat people equally. For example, I have 4 clients I'm dealing with. One of them is from my own country, so I give him better treatment. The others are coming from any other countries. I don't really give them same treatment. That's discriminatory abuse. I shouldn't treat people differently. We are all equal. Doesn't matter which nationality, which religion, which country, with gender, we need to be treated equally. So if you give someone, you favor someone and not treat him like other people, you're abusing the rest. Yeah. So we need to make sure that we treat people equally. Very, very important. So now we have another type of abuse, which is neglect. Could you please tell me what's neglect? Do you know anything? When you hear the word neglect, what does it bring to your mind?
Rejecting someone.
Say again?
Rejecting someone.
Okay, very good. Rejecting someone. Any other things it brings to your mind?
Not show consent to anything the person is doing.
Okay. Very good. Any other things come up to your mind? So for me, neglect it's a big issue. People maybe don't realize how neglect can affect people. So for you as a care assistant, you have a clients, you take care of them. Let us say one day you came, you had long day at home, you really can't be bothered doing so much things. You give them food and drink and forget all about talking to them or sitting with them or discussing things with them. Or this is all neglect. So neglect when you do not really or fail to care for someone. Let us say you don't tell your client to change their clothes, or you don't help them, they are disabled, you don't help them to change their clothes, you don't help them grooming their hair, you don't help them in things. That's a neglect. Also, there is another type of neglect which is self-neglect. So if you as a person, you can't be bothered, you don't comb your hair, you come with your home clothing, you don't change, you don't shower, this is all self-neglect. So when you fail to care for yourself, that's self-neglect. And if you're neglected by others is when others do not take care of you. They don't meet the needs that you need, you have. This is all like will result in self-neglect in others and neglect by others. So very important to notice the sign, because you're working with vulnerable adults. Sometimes these people sometimes they are shy, they can't talk for themselves. Sometimes you see them isolated, you see them crying, but you can't really guess what's going on with them. So you have to sit with them, talk to them, understand their situation, why they are angry today or why they are shouting today, which is unusual for them. Some of them, this is their character, which is maybe you can handle it over time, but some of them, it's sudden. You come and it's suddenly the client is totally different person. He's angry. He's crying, or she's unhappy, unwell, isolated, doesn't want to talk to anyone. So you need to look because you are the protector of your clients. You need to make sure you follow the safeguarding policy, and part of it is monitoring the signs and symptoms of the physical abuse. So the signs, it's mean what you can see on the client, what you can feel, but the symptoms is how this gonna affect them, how gonna change what they feel and how they act or how they react to this. So let us start one by one. Let us first talk about what the science. So the science is, for example, if you see bruises on the client, if you see that they are crying one day, if you see different behavior and you can't really guess why, he's very active and energetic every day, and suddenly he's shy and doesn't want to talk and angry for any reason, or this is all symptoms, signs of the of the abuse. However, when it comes to the symptoms, is how this will make him feel. Make him feel fearful, tearful. He's not being himself, or she's not being herself, withdrawn, and do not want to talk to others. So this is all the physical abuse. The physical abuse, as we said, is anything physical you can do to the client, like hitting them, slapping them. How you can see that? You can see it by the bruises, by the cuts, by the maybe redness in their faces. All this is physical abuse signs. And the symptoms is how it affects them, make them feel uncomfortable, make them feel scared of you. Whenever you see the abuser, they are very scared, they are very withdrawn. But you monitoring this and you don't really know why, so you can sit with the client and talk to them. Now, what the signs and symptoms of the domestic abuse? So as we said, the domestic abuse is happening within the family. So how you can monitor the signs, how you can guess that this person has got domestic abuse at home? Anyone can tell me?
When the person is always quiet and don't want to speak up, it means that he's having maybe emotional abuse, and therefore needs to be attended to.
Very good. That's the symptoms. It means how this gonna affect them. So it is really that you see them fearful. They don't want to talk about things. You always say, "How is your family?" They say, "Yeah, fine." It just you can feel it. Then maybe you can talk to them like, what's going on? Well, why you don't like talking about your family? Is there any problem? Is there anything? So you see them like they don't have self-esteem. They are not happy. They come to work. Any changes in a person behavior, you need to think straight away. You see this person is always positive and energetic, and suddenly he comes or she comes, they don't want to talk. They are very isolated. They are withdrawn. Any changes in a personal behavior, you need to think, is there any abuse happening here? Because it's your job to monitor things. And then if we talk about, sorry.
Also, if the person is behaving strangely as normal, it shows that there is an abuse. And one thing I want to emphasize on that maybe it has not been mentioned is social media abuse. There's particularly the youth. There are so many things that are going on social media that changes their character, and you see them reacting to whatever they are watching on their phones and stuff, and therefore you know that, okay, this person is like this, but he has started doing strange things which is unusual in his or her life. That also shows some signs of abuse, and it can come from social media in these days, in particular, in these contemporary days. Most of the youth are being abused by social media.
Absolutely, well done, very good. Why? Because this is very much related to your work. You're working with young adults, and you always need to think about the social media, which is now available on any phone. They always watching and looking for other people, and whatever the media tells them that they are not good enough, and you need to lose weight, and this is all, lots of abuse could be happening. Why? Because they always believe what they can see on the social media, and what they've been told that people overweight should be straight away losing weight because you don't look like celebrities, and this is all affect their minds. And you need to watch out. Maybe you need to give them some advice about how not to believe the social media, how not to follow it to the extreme level. And well done. That's very good point. Thank you. About the sexual abuse, it's any unwanted contact with any person, from like from touching, from like you can see it on the person. Sometimes you come and see there is bruises, there is redness. If it is not physical abuse, it might be sexual abuse. So you need to always think. You see these bruises, but the client do not want to talk about it. They are isolated, they are scared. Then you have to think, is that physical abuse or sexual abuse? And then also look at the symptoms, how this affect the client. Now they don't like to go to sleep. They are very scared. They are very withdrawn. They don't like any relationships with others, even just a friendship. They are scared of friendship. So you need to always, or maybe they get very aggressive suddenly. Suddenly you talk to the client and they are very aggressive. They don't want to talk to you, even though they were very friendly with you. So any changes you might see, or even they refuse your assistance. Like sometimes you go to their room and say, let me help you with this. They say, no, thank you, leave the room. I don't want anyone in the room. So you need to think it. Don't take things personal and think, oh, this client now against me. They don't like me. They don't appreciate me. No, it might be bigger issue than just that. It might be a type of abuse, and you need to monitor it. Maybe talk with the client. Just say, you've been always fantastic. You've been always doing good things and happy. So what happened today? Why you not yourself? Is there something I can help with? So just show them that you're a friend with them, so you can get as much details as you can and help them and empower them. And just say, if you have, I'm not gonna keep talking about why you changed today suddenly. Maybe you don't want to talk about it, but if you have something in the background thinking about it, please remember that I'm always there for you. I'm helping you. I can discuss things with you. Just encourage them to talk. It's very, very important. Now we have also emotional abuse. This is very dangerous type of abuse because you can't see sign for it. Like let us say the clients are all happy, they are playing games, they are doing things, and suddenly you see one of the clients sitting in the corner, do not talk, you really can't guess what's happening with them. Maybe you talk to them, they don't want to talk. Why? Because like the abuser does this type of abuse, you can't see sign for it. You can't. There is no bruises. There is no marks there on their body. It's not physical. It just affects their mind, how they think about themselves. It will make them really feeling bad about themselves. Their self-esteem will go down. They are not their usual self, very unhappy, very unsatisfied. It just things you can feel it, you can't see it. So here it comes our job as care assistant is to encourage them, to empower them, to talk to them, help them to tell you what's the problem. Then you can give them some advice because you're older than them, you have better life experience. Well, they don't have life experience. They might not be able to really handle situations correctly. So here, your advice is really important, and you need to know what's exactly happening with them, why they are not satisfied, what's going on. So as we said, these symptoms could be low self-esteem, underconfident, distressed. This client might become very angry suddenly, very irritable, and feeling unwell. Maybe they are anxious, they don't want to leave the bed, or this is all emotional abuse. It's just like when you tell someone, oh, what you've been doing, this is wrong, this is not good. Every time you tell him this, it will build up in his mind, and suddenly you see this person is really feeling bad about themselves, thinking like, you know what, I'm not good. Whatever I do, I'm not going to be good enough. So this is all emotional abuse, and we have to really protect our clients from this type of abuse, because we wouldn't be able to see the signs, but we will see them just withdrawn and emotional, and we need to, or maybe tearful. We need to protect them from this. Even families, maybe their family suddenly come and talk to them and visit them, and suddenly you see the client, he's not himself, he's very emotional, he's very, and you talk to him or her, they tell you nothing happened. They didn't tell us, like, my family came and they didn't tell me any bad news. So what's going on? Might be emotional abuse. Maybe his mom or his parents, they were telling him that he's not good in something and he's really bad and he's this and he's that. And this is all built up in their mind because they are vulnerable and they believe things.
Sorry, can I clear this doubt here? I
Of
just want to
course.
ask a question. Okay, fine. So I just want to know if this can be classified as a sexual abuse. Let's say two partners agree to involve in sexual activities. Maybe after the activities, a woman or one of them experiences bruises, just like you are saying. Even though they agree initial stage, can that be still can we still confirm that as sexual abuse?
Can you repeat the question? The
All right,
phone line is not very clear.
Right. I just want to know if this can be classified as sexual abuse or not. Can two partners agree to have sexual activities? Then after the activities, maybe one of the partner is experiencing bruises, just like you said. Can that be classified as a sexual abuse, even though they agreed initially to involve in that activity? But aftermath of it, maybe one of them was experiencing bruises, in his or a private part and stuff.
Okay, so from what I understand, what you said is there are two partners, they agreed to have sexual activities, but then in the middle of this, one of them said no.
After the activities, yeah.
Yeah, some of them said no. So when they said no, they declared that this is unwanted sexual activities. And after that, this person should stop completely. If they don't stop, yes, there is sexual abuse.
No, what I was talking about in this case,
if I may come in, sorry, he's saying that in course of the act, maybe one of them is experiencing an abuse in terms of, let's say, blood or whatever. I mean, for me, it's an abuse because you have forcefully or strongly overdo what you are supposed to do. And therefore, once there's a symptom of blood, it means that you have abused the person, because at the normal circumstances, that should not. So any physical sign which is unwanted will show that, yes, in course of the act or whatever, you have abused the person.
I'm sorry, can you clarify us? Because I'm not getting what you're saying. One, they agree to involve in that activity.
Yeah.
That's one thing. Then secondly, in the course of doing it or after that activity, that was when maybe the woman started experiencing these bruises. So it's not like maybe the man forced his way, within a woman. They agreed to do that. So what I'm saying is, after the act, the woman started experiencing some pains or bruises within her private parts. So I just want to know, even though they agreed to do it in the initial stage, is it still classified as a sexual abuse or not?
I think so.
How?
Because at the normal circumstances, it shouldn't happen like that when you are having a normal sex with your wife. Okay. So if after that there is a blood oozing or something, it means that you might have overdo it. The woman may be feeling the pain, react to it, but you did not stop. And therefore, to have a normal sex, there shouldn't be any appearance of blood. And I think that if there's something like that, it means that you over did what you do out of the will of the woman. I mean, she may express it, but you undermine it, and therefore you exercise your force on him to extent of abusing him, and therefore he experienced that blood.
Thank you, but I still don't get your answer.
Okay.
Thank you so much for your contribution. So for me, if the sexual activities was with the client, that's prohibited. But if you're talking about just couple, they have their life together and they had this sexual activities and suddenly this is happening, if didn't affect the woman and she didn't feel pain and she didn't say stop, then it's just something between them. But if at any moment that one of them will say stop, then that's it. After that, it's a sexual abuse because it's unwanted contact.
All right.
So if someone will say stop at any stage, you should stop immediately.
All right.
Like without any person objective and said no, then maybe they both enjoying the things together. But if it start hurting person and they say stop, then stop, because any unconsent activities is abused no matter what.
All right. Thank you very much.
Perfect. Thank you so much. So yeah, we started talking about the financial abuse. So the financial abuse is, for example, one of the care assistants take the card of the client to buy their own things. Maybe they take the client to do shopping with them and then convince them to start buying them gifts or things that they need and they want. Like I meant about the worker themselves. They convince the client to buy them things. This is all financial abuse. Also, maybe the family of the person, they convince them that to transfer property to their names or any things to deal with money. Someone take money from another person unwantedly. That's all financial abuse, and the symptoms that this person could feel anxious, and suddenly you see your client, he's keep thinking too much, he's anxious all the time. He doesn't want to pay for food because he doesn't have any more money on his card. And you think like, why? You always have money on your card. What's going on? You need to encourage them to talk, sit with them, talk to them, what's going on, because they are vulnerable. Maybe other people easily can use their card to buy their own things. So if you see something like this, maybe food, then you need to speak to the client and stop them from paying for any other person. Also, we have the modern slavery. So we talked about the modern slavery. How you can guess that this person is being controlled by modern slavery?
Where the person does not have a right to decide for himself or herself to where he has been taken to.
Very good.
Yeah.
Yeah. Any other person would like to add something as well?
They always have fear when speaking with others because of how they were treated by the abuser.
Sorry, can you say a little louder?
They are afraid, they fear to speak with people because of how they were treated by the abusers.
Absolutely. You see them isolated. They don't talk to you. They come from different country and you suddenly think like they are working, but they can't speak a word English. They are too afraid. You stand to say hello to them, they don't even say hello back. Not because they are rude or arrogant, or they are too scared. Because this person, the abuser, is always telling them, don't talk to people, otherwise they will transfer you back to your country. They will, the police will come and take you. So it built up in their mind that they need to be away from people, while it's the other way around. They need to learn English. They need to learn how the society work. They need to help themselves and become someone who's important in the society, not just to come and work and get no money, no food, no good treatment, someone yelling and shouting at them. So you can really feel it when you see this type of abuse happening. And you suddenly you need to report it. Like sometimes if you see this type of slavery, you need to talk about it or keep asking, getting more answers. And if you're 100% sure, then just report it, because it is prohibited in the modern world. Now, signs and symptoms of discriminatory abuse. Can you tell me what the symptoms and what the signs for the discriminatory abuse? What the signs, how you can tell that this person is being discriminated against? Like for you, even you, if you are in a job and suddenly your manager discriminated you for anything, how that will make you feel?
You feel bad emotionally,
Very
and
good.
sometimes you feel isolated.
Very good.
Yeah.
Any other things you would like to add?
Discriminatory abuse, I mean, it could be termed as when you're kind of not included in things. So you feel actually that you're being discriminated against. It could be anything. It could be because of your color, your religion, your sexual orientation. So that is discriminatory. So that obviously is quite bad, because you can be discriminated against by anything. It could be anything that you feel you are left out, either because you're too tall, or you think that because you're too short, or you think that because of your disability you're being discriminated against. It could be, like I say, sexual. It could be your religion, and you're discriminated against because of your religion. These are the kind of things that you might be seen to be discriminated against.
Well done, thank you very much. So the manager could, or any person, not only the manager, could be your colleague. They discriminate against you, or you discriminate against the client for some reason. So discrimination could be happening anywhere, but it is type of abuse and should be prohibited in any organization. So, for example, if a person would deny you from the service, or deny you from having certain things that is given to anyone else, that's discriminatory abuse. They don't meet your needs as a client. They don't take care of you while they are taking care of everyone else. For any reason, could be for your religion, could be for your nationality, Could be for your gender, could be for any reason, or for your age. Maybe someone think like, oh, he's old enough, he can take care of himself, for any reason. So this is all discriminatory abuse, and this will affect the human massively. They can become anxious, feeling frustrated and fearful, tearful. They will not be happy or satisfied with the service. They feel like bad about themselves. They think it's the problem, not the whole society. So it is prohibited, it's not allowed in any organization. And if you see something like this, you need to stand up and you need to empower this person. If they face any discriminatory abuse, empower them to speak up, because it's not allowed. Now, signs and symptoms of institutional abuse or organizational abuse. Can you think, what does this mean, bring to your mind?
Institutional abuse, I think, is whereby the institution that you are working with, the company or whatever, denies your rights of certain things in your work.
Very good, very good. So it's lack of management.
For example,
yes.
Let's say we have annual leave for the year, and then you say that, okay, due to short of staff or the nature of the job at this time, we are going to postpone your leave. You will not have the leave this year. Maybe you have something that you have planned to use the leave to do. If they say that you can't go and we are postponing it for you, it's a form of institutional abuse, I think.
Yeah, if it is for no reason, of course it is abuse. But if there are too many people have got the same holiday in the same time, like they wouldn't even have people to cover the area. Maybe they need to work together because they are a team. But yeah, as you said, suddenly the manager doesn't like you and they say, you know what, you're not given a holiday this year. You have to have a holiday no matter what. If he's saying to you, move it to another day, maybe he's got a reason. But if they say, you're not allowed to have a holiday, yeah, this is abuse. You can't not have a holiday because this is in your contract. I can't see what you mean.
Whilst others have been given, you know, but
yeah, while everyone's giving.
Yeah.
Exactly. Absolutely. Also, not only towards the workers, there are some abuse happening towards the clients as well. Organizational abuse towards the clients. Could you please tell me any example about organizational abuse towards the client?
Where you deny the client's right to see their family members or friends, because you think that he or she does not behave well to you.
Yeah, well done. Thank you very much. That's a good example. So the organizational abuse. Anyone would like to add?
Yes, I'd like to add something. Organizational abuse is when particular organizations are set in a way which might not be of any benefit or of much benefit to the people that you're supposed to be supporting. Because some organizations, what they tend to do, they follow some strict terms and conditions, which, like I say, this is going to be person-centered. There are particular ways to actually support particular people. But because the organizations are used to a particular way of supporting people, they tend to actually just use that way and not actually think of being person-centered. So they just use the way the organization has been doing this for months or years. They don't tend to change. Just so it's more of an abuse because you are using the way you're working with everyone the same way for the past 10 years, but you're not actually contributing and actually making it being person-centered. So at least you can now see, you know what, yeah, we should change the way we work with these people. But because the organization is so used to one particular way, they just continue with that, and that is actually termed as an abuse.
Sorry, the voice is not very clear, so I understand a little bit. Could you please say it again a little bit louder, please?
There is an echo
Yeah,
behind
there
it.
is
I
an
don't know
echo
where
in
it's
the,
coming from.
and yeah,
Where it's coming from.
absolutely. Yeah, sorry, Izzy, can you please repeat it? Anyone understood anything from this? Can you please tell me a little bit what Izzy said?
Institutional abuse, one example I can also give, particularly when you go to the rehab centers, you know, where there's a mental health issues, you know, at times you see some of the clients behaving strangely, and if you are not patient, you'll be offended to certain things that they do. And maybe they have the right to be escorted or unescorted to go out of the perimeters to smoke or to go for shopping and stuff. And because you have the right to decide either the person should go or not out of certain things that you don't like about the person, you can deny by writing that, okay, when we gauge your mood, you know, you don't fit to go out, either being escorted or unescorted. You know, when you go to the rehab centers, such things, such abuse normally happens.
Absolutely. So they could deny someone from having a cigarette, or maybe for any reason. They say, no, you're not allowed. While they're allowing other people to do the same thing. They think it's punishment. We need to punish him for something like for any type of behavior he's shown, which is not good. Yes, absolutely. But sometimes the institutional abuse is maybe even by making someone hungry, maybe not giving him food, or lack of choices. I'm not going to give him choices because I think he doesn't deserve it. I'm going to enforce things on him. Or even by, yeah, sorry. Would you like to add something? Okay, so also the institutional abuse could be, not only that, could be by maybe not allowing them to have visitors, as you said, or not allowing them to do things or activities, or even by not allowing them to have choices, just enforce things on them. All this will make them feel really frustrated, really feeling bad about themselves, angry, anxious. Like they always keep building this in their mind, like, why me? Why everyone else is okay except me? This will make them even feel bad, worse, act in a bad way. It's not going to help their situation. It's going to irritate them more. So what we need to do is to make everyone feel that they are included. We need everyone to feel that we have this activity for all. We don't, even, for example, you want to do an activity You need to think about everyone sitting in the room. If you have someone with a wheelchair, you're not going to suggest a football, for example, because this will make them feel not happy. You need everyone to get involved. You need everyone to feel participated. So that's why you always think, who's your audience? What I can give them, so they all feel happy and satisfied rather than thinking about just an activity and forget about others, because this is ignoring these people, denying them from having same rights like everyone else. Now we need to talk about self-neglect. Can you tell me a little bit about self-neglect? What's it bring, this word, what does it bring to your mind when you think about self-neglect?
This is interesting. Self-neglect is actually it's it's in the name. It's when a service user decides that they just don't want to do anything for themselves, including personal care. So what normally then happens is that the person just decides that, oh, I don't want to have showers, I don't have a bath, I'm just going to make my room untidy, I don't want to even eat. But then it's up to us support workers to make sure that that doesn't happen, because that's actually an abuse which is quite common in supported living areas. Because what it is, like when the person states that, like, oh, because when they get visitors and you see that, like, oh, the person is untidy, not well kept, and saying that, like, he doesn't want to eat, so he's kind of self-neglecting himself. He doesn't want to do anything for himself. So it's up to us to make sure that that doesn't happen, and then we'll actually provide the services for him. And that's what self-neglect is, and it's a serious abuse within the care sector.
Well done. Thank you very much. Thank you. Thank you. So anyone would like to add anything else? Okay, so self-neglect. Yes.
For instance, maybe you know that you are not feeling well, that you have to go and see your GP to be attended to, but you say, I'll not go. Whatever happens, happens. You know, and it's a form of an abuse, I think, because anything that the body needs and you deny, you are abusing yourself.
Absolutely. Thank you very much for this example. If you think about it, like most of us do that, like especially when it comes to old age, like for example, my mom would do that always. When you say, oh, why are you ill today, she wouldn't want to go to a doctor. She's like, I'm okay, I'm going to be better, don't worry. I think this is all self-neglect, because the situation could go worse if you think you are ill today and you don't do anything about it. You don't take tablets for paracetamol, or you don't go to see the doctor to check if you're all healthy or not. This is all self-neglect, and same as anything else, as you said as well, for even not having a shower in the morning, not using deodorant, not combing your hair, not wearing nice clothes, not taking care of your nails, your hair, your skin, this is all self-neglect. We all have to take care of ourselves, not only to look good, but to look acceptable in the society. You don't want to go in the train and tram and your hair is messy, your clothing is just not tidy, and or you holding bag which is dirty. So this is all self-neglect, and we should stop it. So if we see our client, they are neglecting themselves because they are adults. You're not going to be combing their hair, or not. You're not working with an elderly people where some of them they might have dementia, so you need to comb their hair to have them doing their bath or to change their clothes. For young adults, it's a bit different. So if they self-neglect, you need to speak to them about it. This is not acceptable. You need to look great, to be clean. All of us do. just empower them to take care of themselves. And if they do self-neglect, you can see that they feel confused. They feel sad on that day. Maybe one of the family visited them and told them very bad news. So they don't start not brushing their teeth, not combing, not having shower because they are really, really sad. So maybe when you see this, you need to talk to them and get them out of the situation. Tell them why they are alive, why they should be happy, and do some activities with them. Just think about any way to make them come out of their situation and think differently, so they stop neglecting themselves. Now, signs and symptoms of being neglected by others. So, what is mean neglected by others?
Where
Not being accepted in the society.
Yeah, say again.
Not being accepted in the society.
Okay, yeah, that's a big deal. Very good, thank you. Like suddenly you see one of the clients, whenever he comes to the room, you think, like, why he's here? You call everyone to tell them good news in the center, something new will happen to the center, and you don't knock on someone's door because you think he's not important. You're not going to bring this client. So you neglect them for some reason. Well done, thank you. Any other things you might think about neglect by others?
where a client is so vulnerable that he cannot use the washroom by himself or herself, and he has messed up on bed, and it has taken a long time, expecting that someone will come and give him or her a personal care, and it's not done. It's a neglect.
Well done. Yes, exactly. That's a very good one, because not everyone is healthy, not everyone is able to do things. If a client is disabled and can't do everything for themselves, then they expect us to help them in this bathing, move them from their bed to their wheelchair, or so many things. If you leave this client in their bed all day and you don't go to speak to them, you don't move them to the wheelchair, you don't take them to have a shower, you don't help them to do the brushing, you don't, this is all self-neglect. If you don't bring them food, because they can't do these things, they are so vulnerable, they need us, they rely on our support. If we don't offer this support, that's neglect. That's not only abuse, it's abuse and neglect. Well done, thank you. How this will affect the client, you think? When they are neglected by us, suddenly we don't really care about that client and we don't do things for them. How that will make them feel while we care for everyone else?
It affects their emotions.
Well done. Any other person can think about how this might affect them?
It affects them mentally.
Well done. Affect them mentally, affect their emotions, make them withdrawn, not satisfied, not happy, not
They feel neglect.
very good, feel neglected, low mood, fearful that people might just forget about them, confused, like why it's been happening, why they are not treating me like a human, why they don't take care of me. So this is all make them feel really bad about themselves, and you are there to make the client feel good, feel positive, because you're not only helping them, you building their future. You're helping them to express their needs, to get better in what they're doing. You have a huge job on your shoulder. So neglecting one of them, that will make them really, really feel sad and feel isolated and not being feel respected. If you don't feel respected as a human, not only the client, if someone doesn't respect you, they, let us say your partner, you go home and she's not taking care of herself or the house, or you as a person, you go and you neglect your family, you don't visit them for a long time, you go to another partner and you live with her. This is all make people feel really, really bad. So it shouldn't be happening to anyone, let alone to your vulnerable client. Now, describe factors you may contribute to an individual being more vulnerable to abuse. So there are some people are more vulnerable to abuse than others. What's the reason? Like, what do you think could make you as an individual more vulnerable to abuse? Can you think about reasons?
When you are physically disabled.
Absolutely. Like, this is number one. If someone has got mental health issues, if someone has got disability, any type of disability, could affect people. Why? Because they are more vulnerable. You find them, anyone can abuse them. So this is main issue. Any other things you can think of?
Yeah, previous abuse.
Very good, very good. If someone previously been abused, they will be more vulnerable to abuse. Why? Because everyone thinks like, you know what, it's okay, it's normal. It happened in the past with me. If it happens now, I'm gonna take it. No, it's not normal. You need to stop them from this thinking. You need to say, look, this is abuse. You should say no if this is happening to you. So it is being more vulnerable to abuse if you've been abused in the past. There's no way any two people can say no to this. Well done, thank you. Any other things you can think of? How about the low self-esteem? So if a person has got low self-esteem, for me, if I'm not strong enough to protect myself, if I'm feeling shy and withdrawn and not being able to talk to people and not being able to express my feeling and how I want things to be happening with me, I'll definitely get abused. So you need to have good self-esteem. That's why we always empower our client to be strong, to be watching out for themselves, to be able to speak up. If something happened to them, encourage them to speak up. Because being with a low self-esteem, being vulnerable, being all make you more like able to be abused. Any other things you can think of? Also the negative experience, like if someone had any negative experience, like let us say being abused by someone, and when they told the manager or the supervisor about it, he got punished even though he's been abused. Why? Because the manager or the supervisor is a friend of the care assistant. So any negative experience is stuck in someone's mind. If something happening later from the same nature, they will be like very scared to say anything. Why? Because he will be punished again. The manager is a friend of the client, of the worker, so they will be helping each other. Something like so. Not only being abused in the past may affect them, but also negative experience might affect them. So we need to watch out for this massively.
When you have a bad assessment record,
Oh, yes. Can you tell us more about it? That's a good one. Thank you.
Yeah. For instance, when your assessment shows that maybe you are being imprisoned, we have criminal acts, and like you were saying, when you begin to misbehave a bit, because of your record, people begin to abuse you because they think that that is how you are.
Absolutely. So people situate away. If someone had lots of problems in the past and now suddenly, I mean, talking about the clients, and suddenly the client is really acting normal and nice and polite and just changed because he's growing older. If this will affect him massively because any abuse could happen. If you report abuse to the management and they go and check his report and see he's got really terrible bad history, they won't think he's just being lying. No one will believe him. They think like, no, he's not being abused, he's just being lying because of his history. So history records really could make people vulnerable to be abused. Well done. Thank you so much. Now, action to take if there are suspicious that individual being abused. So what would you do if you thought one of the clients being abused, but you don't know whether this is really happening or not? Like you go and suddenly the client's either crying or scared, doesn't want to leave her room or his room, doesn't want to communicate to others, just shouting at you saying, leave my room, I don't want anyone in my room, and they close the door, lock it. I don't know, anything could happen. Something like this. Why would you suspect, what would you do if you suspect that abuse been happening?
You have to report it to your line manager.
Very good.
And you must always have evidence when there's time for them to discuss what you saw, if it was true or not, so that they will use that evidence to know what exactly happened.
Absolutely, well done. Sometimes you go to their room, you talk to them, they don't want to talk. They don't want to because they are young, they don't want to talk about it. They think that they can't solve their problems by themselves, while for you, it's abuse happening and you can look at the science. Is there, for example, some furniture being smashed up? Is there a glass on the floor? Is there a blood? Is there this? Is there that? Is there cuts? Is there bruises? Is there you need to watch out for any small thing because the client suddenly changed his behavior or her behavior. There is something. You need to watch out for these small signs. Well done. Thank you very much. Any other things you can do? As well as that, informing the management. Any other things?
You can also, I think, do one-to-one with a person and support him or her of what is affecting him.
Absolutely. So even if they don't want to talk about it, you need to show them that you are supportive. You are not only working there, you are very supportive of their situation. You are just like more friends. So you sit with them, just say, look, I can support you, I can help you, I can see you change behavior, but I know you're a very good person. This is not usual for you. You are very angry, you're not yourself, you've been shouting since morning. I need to know what's going on. You need to tell me. I can help you with everything, but first of all, before I can help you, I need to know some details so I can help you and support you. So you need to do one-to-one with them, encourage them to talk, show them that you're supportive of their situation, you're not against them, you're not going to be against them no matter what they're going to tell you. In fact, you are there to support them all the time. And also you need to record this. Let us say the client, suddenly you've spoken to them and suddenly the clients told you that they've been abused by this person. Bring something and record it. You need to record everything telling you, the client telling you. Why? Because you don't know if his parents might go to court for this particular, if it is a huge issue, if it is a small issue you can solve. You need to know details. You need to get all the details on paper first of all. Why? Because this client might forget these details and then suddenly end up with nothing to tell the management, because when you take the client to speak to the management, they can't even remember the most important details. So you need to put it in writing, you need to put the date, you need to take his signature, especially if it is a huge issue, like, for example, a sexual abuse. The police might get involved if it is really, really like a huge thing, not only touching and so you need all the details to write it down and record it and only facts. You don't need waffles. So if the client's telling you lots of more details which you don't need, I opened the door, I go from here to here, I sat on the, give me just the most important event, all the facts. You don't put, okay, the client said, okay, I saw that the client feeling sad. How do you know? You need facts. Whatever the client's telling you, you put it on paper, and you need to sign it. You sign, they sign it. You need the date. So all these activities be recorded, so that organization doesn't get a problem, and also you don't get a problem. You need to sign to record everything. Also, you need to preserve any evidence. So if you think, take a picture, because some abuse is huge, you need to report it. Maybe the management will bring police. So you need to make sure that the evidence is there. You're not gonna brush the floor and call the cleaner to tidy up just to make the room look good for the client. No, this is a crime. You need to investigate it. The management need to find out about it, and if it is really, really huge, you need to inform even the police, the social service, many things. So when abuse happening, try not to remove the evidence before you tell your management. Now, action to take if individual alleged that they might be in abuse. So we all understand that when you work with a young adult, not everything they tell you is correct. So sometimes there is allegation that he might do any allegation just to get rid of one of the workers because they don't like them. They say, oh, he's been sexually abusing me, or he's been doing this, or he's been doing that, he's been hitting me, kicking me, he came to my bed and start shouting at me, yelling at me, always something like this. They are young. They sometimes express themselves in a different way. Their imaginary is huge. So if there's any allegation happening, what we can do? Do you take it just straight away and go to the management and report it, or you need to take steps first? Because it might be correct and it might be not. So what would you do?
First, you must listen to the client and make sure that they know that you support them and you're going to help them in the situation they went through.
Well done. Thank you very much. Any other things you can think of?
Yes. Hello, it's Easy again. Yes.
Hello.
If a service user alleges that they've been abused, it's always a good idea to actually get have a colleague with you, okay, and then let the person that has kind of alleged that has been abused say exactly how they were abused and who abused them. It could be yourself that they alleged abused them, but then you have somebody that is there. You have a colleague that can always witness. So once the person has said all, because they might actually say, they might not tell you that you're the one that will abuse them. They might just say somebody else had abused them. Obviously, you don't get that person involved in the conversation because the person might not want to say anything, or might say, "Oh no, I was just joking." So always get exactly what the person has stated, that like they've been abused, what kind of abuse they have, and exactly what happened, not what they thought happened. Not, they can't say, "Oh, he leaned over me and I thought he was going to kiss me." That's not a fact. He might be leaning over you to actually put on the light or something. So there have to be factual allegations that are being made. Once this has been taken into, once this has been received, then you can now pass it on to management. It's very, very important. It's written down correctly and passed on to management as soon as possible, or in short, immediately. Actually, do not wait, because that same person might have told somebody else or told 3 other people. So because when they'll ask you what time did they state that like you've been the alleged the alleged abuse. If you say, oh, the alleged abuse about 10 in the morning and you're reporting it at 4 in the evening, that's not good enough. You have to actually state exactly when it was reported to you and then report it immediately. Thank you.
Well done. Thank you very much. Thank you. That's really good. Any other person would like to add something?
Yeah, to add to what my colleague has said, first, think when there's an allegation by a client, you should show consent and be attentive and listen to whatever he's saying, and not in the process rebuke him in any form. And as they said, you have to put every discussion in writing. And if he's not satisfied and is beyond your control, then you have to pass on to the next person in line, so that the management will handle it.
Well done. Thank you very much. Thank you. So if there is any allegation by any person, would you like to add anything? Anyone else would like to add anything? Okay, thank you. So if there is any allegation happening by any young adult to like you go in the morning, the young adult is not satisfied and is not happy and has been shouting, and you talk to them, they say someone has been physically abusing them. So this is a huge issue. It's an allegation has been put towards one of the employees. You need, as we said, to record it. Make sure you take the factual things, any facts, you write it down. What happened, what's the name, who did it, everything, how this affected them. You need to write all the details, all the facts in the sheet, and then you need to pass it to the management. Let us say that these allegations happening against you. Suddenly you go and then the client say, I don't want to see your face in this room. You've been abusing me. You've been doing this. You've been doing that. You need to bring someone else to record it. You need to speak to them and say, just like, what's going on? Do we need to discuss it? Can we sit and discuss things? I haven't even laid my hand on you. So you need to bring another person just to be observing what's going on and how you're going to talk to him, because they might even build bigger story for this. Now, let us say you wrote all the details, you took all the facts from the client. You need to pass it to the management. So the management will do a thorough investigation, talk to the client, discuss what's happening with them, what's the abuse, who's the abuser. All these details need to be reported, recorded and reported. And we need to keep all the evidence secure. So if there is any abuse happening, we need to make sure that we reserve this evidence. If it is, let us say, the client is being physically abused, so his face is red, there are some bites on his skin, whatever. What we can do here, because these things you can't really reserve it, you take pictures of it. So it goes with the report that you pass it to the management. But if there is any other breakage in the room, make sure you keep all these evidence for the thorough investigation from the management. And also you need, as we said, to record only facts. Don't write that I saw the clients sitting sad or miserable or depressed. All these things are not really related, because this is how you feel. It's not how the client feel. You need to speak to the client themselves and know details and put it in your report. Very important. Now, way to ensure that evidence of abuse is preserved. So how we preserve our evidence? Can you think about way to save the evidence? Because we said the evidence are extremely important in our thorough investigation if there is any abuse or neglect happening. So what we do to reserve these evidence? Can you think about ways? Yeah.
Okay. Assuming you have written it on the paper, you can preserve it by transferring it to the computer and save it, and also put the one on the paper on the file and keep it at the right place.
Okay, very good, thank you. Any other things you preserve the evidence? So first of all, let us say there was sexual abuse. So if there is a sexual abuse, you should never encourage the client to go to have a shower. Why? Because this is a big deal. You're not gonna just cover it. You need to bring the management need to inform the police. So here you shouldn't encourage them to have a shower. You shouldn't encourage them to change their clothes. No, you need to keep everything preserved until someone investigates it thoroughly. Also, you need if there is any, as we said, physical abuse like bruises or cuts or bites or even anything on black marks, red marks on their skin, you need to take pictures of it. You need to inform the management immediately. So taking picture is preserving to the evidence of neglect or of abuse. Also, the broken things, let us say a vase being broken, the worker was really angry, took the vase and hit the wall with it, or anything being broken on the floor. You can't clear it, you can't clean it or remove it. You need to make sure that it's been investigated thoroughly as well. Also, if there's any witness testimony, it's very important. So if there's any witness in the area pass through, let us say, night shift, heard them talking, or a night shift heard them shouting at each other, the employee and the client. Very important to take all the information from the witness. Use it as evidence in your report. Just say there is a witness who's the night shift, happened to be in that area. This is what he said. This is the time. He need to sign as well. So you need to reserve all these. Is there any visible injuries? Is there any cuts? Any physical abuse? All this need to be taken pictures of. Also, if there is anything, fingerprint on it, let us say the client said he, for example, the worker took a glass of water and throw it in his face, the water. So here you need to save this glass make sure you wear gloves, save this glass in a bag. Why? Because the fingerprint on this glass. You need to preserve anything that you take care of what the client says to you for in details, and make sure you watch out for all these things that the client has highlighted in his or her token or complaint. Now, identify sources of information and advice about on role in safeguarding and protecting individual from abuse, including whistleblowing. So you as the employee, could you tell me how would you collect information and advice about safeguarding? What would you do to update your knowledge regarding safeguarding? Like if there are something you're not sure of, what would you do?
Well, if you hello, it's easy again. If you're not sure of exactly what to do, always go to your line manager, because what it is, like, you let your line manager be informed of what is happening, and whether it because your line manager is the one that will actually raise a safeguarding issue, and this actually goes to the local authority that you're working in. So your line manager will raise a safeguarding issue, and then there will be the necessary investigations. They might actually include some other professionals, that will be involved, including the police, if necessary, and CQC also will have to be informed, or as for young persons to be offset. Yeah, that's it.
Okay, thank you very much, Izzy. Anyone else would like to add? So where would you get the information from? Can you think about all the resources for the information? So as your colleague said, there are so many resources for the information if we want to collect information about how to protect the individuals from abuse and harm. So first of all, is the manager, the person who we need to communicate to, ask questions. If we're not sure about something, the manager is easy to find, always there available for the employees. Just you need to get their advice. Also, there is the supervisor, the person who's senior in the organization, has been there for much longer than you. They might know more about this particular situation, so you can take advice from them, because they've been with the client for much longer, so they know everything about the client, their history, what happened with them. Even though it is in their care plan, there might some information you might not know as well, so it's good to have their advice. Also, you can take the advice or the information about safeguarding from the training. That's why we're doing training now as well. And also you can contact the local authority. You can search the net. There are so many information. You can contact Care Quality Commission. There are so many organizations can help you provide information about abuse and neglect. Now identify when to seek. So we know now who can help us if we are seeking information. So when do you need this advice? When do you need to seek support? When do you think you need to seek support?
when you find yourself in a situation that you have not been in before or have no experience, you have to seek for support.
Well done. Very good. We're all been in this situation, like even sometimes using the printer or not only abuse and huge issue. There are so many things we don't know how to use or how to deal with. And especially when it comes to abuse, it's a huge thing. So if there is a situation where we don't know how to act or react towards it, then we need to seek advice. Well done. We can't just think like, okay, it might go tomorrow. No, it's a huge issue. So if there's something where you don't know how to act, or situation, or a person you don't know how to treat him or her, then you need to ask an advice. Well done. Any other things you can think of where you need to seek advice? Yeah, so if you pass through any situation where you don't know, or maybe there is a complicated thing, like you don't know, the family been involved, something happening, it's a big deal now. Okay, you know how to act, but it's a huge thing. Now it's not only, let us say it's a sexual abuse. You can't just sort it by yourself. This is where you need the management to take an action. So you need their advice, you need their being there for you and for the client. So there are some complicated situations where you definitely need someone else to help you with that, not only advice, or you need the proper support. Now, ways to reduce, yeah, sorry.
When the matter involves, let's say, litigation where court has to come in, you have to report it to the management to be able to handle it.
Absolutely, yeah. If there is a huge allegation towards, let us say, a huge allegation towards the manager, the direct manager himself, or a huge thing, you can't just go to the manager and say someone's been complaining about you. So here you need an advice from the head of the organization as to why is this happening. So the as you said, yes, it is very complicated subject, the abuse, and we need to make sure that we are doing the right thing at all times. So if we're not sure about any situation, we straight away take an advice. Well done. Now, ways to reduce the likelihood of abuse. So how would you reduce the likelihood of abuse? Can you think about ways to reduce it?
You have to be familiar with the policy of safeguarding.
Okay. Explain a bit more, please.
And also, you have to attend trainings like this to update yourself. And
well done. Very good. Thank you so much. So first of all, if I'm going to any organization, I need to check their policy and procedure, as we said before. I need to know what's happening with every single situation. So it's very, very important to always follow the policy and procedure of that organization. Also, we need to attend the training. So when you start, you will get a training, and every year there is another training, especially for safeguarding, for health and safety, for many subjects which relates to your work at every day. So that's why you need to update the knowledge to reduce any likelihood of abuse. Well done, thank you. Any other things you can think of to
Yes.
reduce the yeah?
Yes. What I was also thinking is you have to be because you are looking after, you are caring or supporting somebody, so you have to get that person's confidence, so that like the person will. It's more like having a person-centered approach to supporting somebody. Once the person knows that like yes, you have them, you have their best interest, okay, they will actually attend to whatever things that might be causing them or might be in relation to an abuse, and they have that confidence to talk to you about it. But you can actually reduce it by having that communication with whoever you're supporting, so that person actually has any issues in relation to abuse being reduced, because they can ask you for things, they can tell you they have issues with having a personal care, they don't know how to wash their back, or they have this phobia for water, just things that they feel confident with you. So what now happens, like they feel confident that like if anything happens, they've got the organization and staff at hand. So that will reduce likelihood of anybody stating of any kind of abuse, because of the person-centered approach to their care.
Well done. Thank you. Thank you very much. That's great. Thank you. Any other person would like to add something?
You should also act professionally at all times.
Well done. Very good. Can you explain a little bit more about it?
Yeah, like I'm saying, when you are working in a care setting or any health care environment, you have to know, one, as I said earlier, the policy of that place or the company you are working with, and do things as the policy requires. Like we're talking of maybe abuse, sexual abuse or something. You have to make sure that you report it to the right office or the rightful person. You have to take records of whatever has happened, or you have to take pictures, or in fact do things to act professionally. Is do things according to the policies that governs the well-being or the welfare of the people, and don't assume things by yourself in whatever you are doing.
Well done. Very good. Thank you so much. Exactly. If we keep assuming things, we will never reduce the likelihood of abuse. If we see someone, for example, from our clients is sitting crying, if we assume that he's just sad for the day, we wouldn't stop this abuse happening to him. While what we need to think, we need to sit with them, talk to them. If we see any changes in behavior, we shouldn't have assumed that this person is just growing up violently and he doesn't want to talk to anyone and he doesn't like anyone. No, we can't assume things. We need to sit with them and talk to them. We need to exactly know why they are behaving badly, why they are behaving differently, what changed in their situation, and then we can reduce or stop the abuse if this is really happening. First of all, we need to, all of us, as care support staff, we need to use person-centered approach, which means we treat the person as an individual. We don't assume that we have this particular clients, we have like, let us say 4 clients. I'm not going to assume they all need same things and provide same things to them, because this is neglect to their needs and also abuse to their as a human. So what I'm going to do, I'm going to use person-centered approach. Every one of my clients, I put him in the center of my activities. I need to understand their care plan. I need to understand their situation. I need to meet their family. I need to know what's going on in their lives, why they are suddenly changing behavior. I need to build my care on every single person as an individual. I'm not going to treat them all same. I'm going to focus on each one as the only client I have, and I take extra care of them. I need also to encourage them. So I sit with them, encourage them. They are adults. They need to speak up. If something happening to them, they need to tell me, to tell the management what's going on with them. If you don't do that, they will be always, they have lack of self-confidence, and they wouldn't be able to support or encourage themselves or support. So you wouldn't be able to support them. So you need to encourage them, empower them to speak up. And you need to encourage them to have an active participation. So let us say you have an activities, and so many ones of your clients opt in and they want to do it. One of them do not want to do it, sitting somewhere in the corner reading or whatever. It's good for them to have their own space, but you need to encourage them to be active all the time. You need to be part, encourage them to be part of the group, because this is all will make them feel independent, feel valued, feel important. So you need always to encourage them to value their opinion, to value what they say to you. Never going to put them down just or shut their ideas and say, no, this is a very stupid idea. Please do not talk about this again because this. No, you need to, even if it's a stupid idea and might get them hurt, you need to say, I totally see where you're coming from, but let me tell you what's behind this idea. And then you can tell them, but you shouldn't shut them down and say, this is very silly, you shouldn't think of this. You need to always encourage them, empower them, make them feel huge and important in the organization, huge and important to you. Not to make them feel bad or sad or underestimated by the organization. Active participation is highly encouraged, and also person-centered value. Now, yeah.
Sorry, to add to what I said earlier, that you have to be professional. I think to avoid abuse also, you have to be emotionally strong. You have to have emotional stability, because you are dealing with vulnerable people, and it's so easy to do things from the normal way of doing. And therefore, if you take care of them and you don't have emotional stability, you are offended, you can easily abuse them.
Absolutely, yeah. You need to encourage them to be emotionally strong, because this is life. They're not gonna stay in that center forever. They need to grow up. They're gonna go to their own life. You need to encourage them. If you see someone shy and sitting always quiet, do not like to participate, you need to encourage them to take action, to take part of the activities. Why? Because this will build their build them as a strong person, provide them with emotional comfort, make them feel important, empowered, protected. That will help them in the future to build their own life, rather than if they always be shy and vulnerable, and this will carry on for later, and they will be abused later on when they leave the center, which is not good. This is not what you want. You want to bring up a very strong society. So this person needs to be empowered. Well done. Thank you so much. How about also we promote choices and rights. So when we do things, any activities, we ask them, we talk to them, like, okay, what do you think about this activity? Tomorrow we're gonna do this. Today we will do that. When you promoting choices, that will help them. That will encourage them, will show them that they are important. This is how you should be treated. Keep asking them. It's like you, for example, if you are in a staff meeting and then the manager is always saying, okay, we're going to do this, we're going to do that, we're going to do, this will be changed. This never ask you, okay, what do you think, guys? Are you happy? Are you satisfied? Give me some ideas. He's never doing with you um, a brainstorming. He never asked you about your contribution. Never asked you. You will not feel good about you even being working there. So, and same thing for this young adult. They are even more vulnerable towards anything. So when you don't encourage them to take part, to tell us their opinion, that will not make them feel good about themselves. So it's always preferable to encourage them to talk, encourage them to tell you what they feel, and if they like things or how they like it, when they like it, everything. It's good to take their opinion. Also supporting individual with awareness of their own safety. So let us say someone, you come and see them, there is a bruises on their faces, and when you talk to them, say, is there a problem? What happened to you? You are suspecting there is abuse, but the client is always saying, no, I hit myself, I fall on the stairs. He's too scared to tell you what happened to him or her, because they have fear towards the abuser. Let us say he's a manager, he's important, or he's supervisor, or he's really big person, so they are very scared of him. So here it comes that you support the individual of being aware of their own safety. You need to sit with them and say, this is not, can't be happening. You always have these red bruises. This is not good. You need to tell them if there is any abuse happening, if there is any harm, you need to tell me, you need to tell a supervisor, you need to tell someone. You shouldn't be sitting quietly. I need to help you, I need to support you, but you're not telling me what's going on with you. You can't be falling on the stairs every day, or you can't just make them aware of their own safety, and how they should react to certain situation. Tell them that if there is any abuse, you need to tell me. I can help you, I can support you, I can tell the management about this, but I need to know more details. So when you encourage them, that will help them a lot to tell you and talk to you about it. Now, explain the importance of an acceptable complaints procedure, an accessible complaint procedure, and reducing the likelihood of abuse. So, what's the importance of having an accessible complaints procedure? Why our complaint procedures should be accessible to everyone? What do you think? The reason? You have, all of us have, yes, sorry.
So that
Yeah,
in terms of investigation, those who are supposed to do the investigation may have access to everything that went on.
Okay, well done. Thank you very much. So if
yeah,
we
hi.
don't, yeah,
It's always good to have the complaints procedure as easily accessible as possible, because it makes it easy for whoever wants to make a complaint to actually have access to it. It could be either staff, it could be the support, the service user, it could be a visitor or a professional. So if they see that to follow the complaint procedure is quite easy, in the sense that they can just pick up a form from the section in the house where the complaints form is. They can actually now complete the form, and they don't necessarily have to put their details on. Just make the complaint, and because what tends to happen, the form actually has, some of the forms have complaint and compliments section. So at least if there's any compliment, they can still put it. If there's any complaint, they can put it, and they don't necessarily have to put their details on. So if it's accessible to everyone, so it's easier. And remember, when somebody makes a complaint, it's not necessarily a bad thing. It's not negative. A complaint just makes the organization know where they're going wrong, or a part of the organization that they need to improve. So that's why it's very necessary to actually have it accessible. Thank you.
That's perfect. Thank you so much. Thank you. Any other person would like to add anything? Yeah, so just like what your colleague said, first of all, we need to stop any kind of abuse or neglect happening in the organization. That's why we need a protective complaints procedure. We need to make it accessible to everyone. The complaints form needs to be in a place where it is accessible to people. We shouldn't deny any person from a complaint. Why? Because we need to stop any wrongdoing happening in the organization. Second thing, as your other colleague said, we need to learn from our mistakes. The complaints might be small, it might be big. So if it is like about abuse or sexual abuse or financial abuse, that's a huge issue. But sometimes the complaint is really small, but will help us to improve the service. Like for you as a support worker, you should never take the complaint as personal. Why? Because if you're doing something wrong and the client is saying you're doing something wrong, put it in writing. That will help you to improve. Nothing personal there. As long as they didn't make any allegation, maybe sometimes they have the right. You think like, okay, let me change the way I'm dealing with this particular situation. That will make life better for my clients. So it might be just the small things might help you. Any feedback is very, very welcomed by anyone. Why? Because it will make you improve the service, make you improve your own work, and improve the life of the clients. And if it is big issue, obviously, so the organization will handle it correctly and stop the abuse from happening. So therefore, the organization must have policy and procedure to make a complaint and make it accessible to everyone, so the organization improve the life of their clients. So we finish our subjects to here. Any questions, please? Do we have any questions?